Well, hey guys, I'm Bryce Samar. I'm coming to you today from Campus Co-working Space in Jefferson City, Missouri. I'm here with a friend of mine, Tom Bickle, and we have a very exciting, very important message for you that I think a lot of people out there are going to be excited to hear about. My friend Tom has been in the health insurance business for going on 20 years now. So he's an authority in the space, he's an expert, and he has weathered the storm when a lot of other people didn't stick around because, as you know, the healthcare industry has gone through a lot of changes, especially with the health insurance. There's been ups and downs and twists and turns. So I'm a good case study of that. I have been through a lot of changes over the last several years. In 2010, the Affordable Care Act was introduced. A lot of people call it Obamacare, ACA, what is it? The exchange,
the exchange,
is
marketplace. Correct.
So it has
got
a lot of different
meanings, unfortunately. Too bad we can't just have one.
So we're going to tell you a little bit about that. We're also going to tell you a little bit about some alternatives for people that may work a lot better in your situation, depending on what that situation is. So a little bit about me and my backstory. Since Tom has been helping me with my health insurance over the years, my income has fluctuated dramatically. My family size has changed a lot, and we have bounced around from a lot of different providers, and we've gone through a lot of different plans. So I feel like I have a good grasp of what's out there. And he recently turned me on to something that revolutionized the way I think about health insurance. It's not health insurance, but is it better than health insurance? I think it is, and I'll let you decide that for yourself. But we're going to talk a little bit more about that. This is going to be an impromptu, off-the-cuff video, very informal, and we're just going to be visiting a little bit here. So, Tom Bickle and Bryce Samaro, the two best-looking guys talking about health insurance on the internet today. Tom, let's talk a little bit about the astronomical cost of healthcare today and what drives it up so high. So, as I understand it, there's a lot of factors going on. And this is really interesting. In the only industrialized nation in the world without universal health care, people are at a point where they're paying these huge premiums monthly, and yet their deductibles are so high that they can't afford to go and actually use the insurance because they're never hitting that deductible cap, and everything that they're having done is out of pocket anyway.
Subject to a deductible, right?
Right.
Yeah.
Which they may never meet.
Right, absolutely. Fortunately or unfortunately, since the Affordable Care Act was implemented in 2010 and fully was implemented in 2014, insurance, your deductible, out of pocket, and cost in the individual world is based on age, family size, and gross adjusted income. That makes for a recipe of disaster for a lot of people. Self-employed, W-2, it doesn't matter. There's just a lot of people that aren't qualifying for the tax credits. And if you don't qualify for the tax credits, the cost of these on-exchange policies is astronomical. As I told you before, I have a client in Illinois that we had a high deductible plan on them, and that plan in 2009 was $380 a month for that family. In 2019, that plan is $3,800.
Oh my gosh. That's incredible.
Nobody can afford to pay that.
Okay, so let's talk a little bit about why this is. People, it's health insurance, but it's actually not health insurance, it's a prepaid plan.
Right.
It's a prepaid health plan based on a projected range of services that the average American needs, right?
Right.
Okay, so for healthy individuals who aren't taking these high dollar medications, who aren't on dialysis,
Right.
and who plan on staying healthy, who are non-smokers,
Right.
this may be a horrible fit for them because they're paying
Absolutely.
for a lot of people that are using those things, and they're paying for a lot of things that they're never going to be taking advantage of,
Correct.
right?
Absolutely.
Okay.
They are paying a premium rate because these legacy carriers in each state have to offer the ACA health insurance contract, which basically says that, any and all medications, regardless of if you are going to have $1 million in claims starting the first month of that policy, that company, that plan has to pay for those services. That builds in a lot of cost. A lot of us are pretty healthy and are really looking at health insurance for the God forbid. What if we have a major accident? What if we do have a major illness? We want to have insurance and be insured against a catastrophic claim. That has become a very hard scenario for a lot of us to find a plan that is going to insure us against a catastrophic claim and be affordable.
Sure. We feel like we have a workaround for this.
We 100% do with Alira.
Right.
It is a health sharing company. It is not an insurance company that is regulated by your typical insurance department from state to state. This is basically a co-op where like-minded people get together and we share in the medical costs that we have. Now, Alira is set up like a typical insurance plan where you're going to have preventative care covered at 100%. Your primary doctor visit is going to be covered by a copay. And that copay does cover the doctor's charge plus any other services that you're having done. That's a big deal. And those copay benefits extend to specialist, urgent care, ER, and medications. The drug card isn't going to be one that is meant for somebody that is going to be coming into this plan with $1,000 a month in medication.
Okay, so this isn't going to be a good fit for everybody.
It isn't. I mean, if you're an insulin-dependent diabetic, if you have MS, you're going through cancer, this isn't going to be the right plan for you.
Okay, so let's look at that. Let's take, who are the people that this is not going to be a good fit for? People with TRICARE.
Correct.
That's not going to work for them.
Right.
Probably they've got something already.
Absolutely. Medicare.
People that are receiving tax credits through the marketplace.
Correct.
They're covered. They probably are not a good fit
Probably
for this
are not.
right now.
Right.
People on high dollar prescription medicine.
Right.
With very serious pre-existing
Chronic,
conditions
yeah.
like autoimmune disorders.
Diabetes,
Okay.
insulin-dependent diabetes,
Okay, they may not be a good fit
Correct.
for this. But for the average
chronic cancer.
healthy person,
We're all healthy-ish, I mean, nobody's 100% perfect, but, certain chronic conditions are very expensive and are maintained with very expensive medications. If you're not in that ballpark, then we probably are going to be a real fit for you. And we're going to give those people all the upfront benefits that they want on preventative care and doctor visits and ER and urgent care and medications, that you're going to need for your typical, illnesses or accidents. And we're going to be there for obviously the catastrophic coverage that you're going to need in the hospital. Sure. If you have $300,000 in claims, that's where obviously the real crux of having insurance comes from. If I thought, and I knew, not thought, if I knew that I was never going to have a medical claim over $30,000, I would not carry health insurance. Because the only reason we really carry health insurance is to maintain our assets against a catastrophic claim.
Interesting. Okay, so a lot of people want to have coverage also, not only for the catastrophic reasons, but also to avoid these tax penalties we've heard so
Right.
much about.
Absolutely.
On your income tax refund at the end of the year. So we talked a little bit about this before. Can you go into that briefly for us?
I can.
I know you can. You're the expert.
I do. Tax penalty.
For the tax penalty, we've heard a lot about it. People were up in arms about
Absolutely.
it. It made a lot of people mad.
Absolutely.
Is that still around? If so, is Alera going to cover them on that base? Let's talk a little bit about that.
So, with the penalty, as of tax year 2019, it has been moved to zero. The penalty has, if you do not have an ACA qualified plan.
Okay, so in effect, it's basically like there's not a penalty
Correct.
right now.
Correct. It could still be brought back.
Sure.
There is the potential for that. And Alera would set themselves up, as they did in the past, to then give you an exemption. So if you have Alera and there is a penalty in place, then you received an exemption. So you weren't taxed for just not having their plan.
Okay.
Yeah.
Okay, cool. All right. So we're covered.
Correct.
We have no penalty.
Correct.
We're saving people in a lot of cases half off of their premium cost.
Absolutely.
In some cases, more than half.
Absolutely.
I mean, it honestly, it sounds too good to be true. It seems like there should be some kind of a catch, because people are saving $12,000, $14,000, $15,000 a year by changing to Alera in some cases. I mean, we know that.
Absolutely.
We've talked about these people. You have specific.
Absolutely. Every day, every week.
Yeah.
I mean, right now there's a family out there that's paying over $2,000 a month for their health insurance, paying over $1,500 a month for their health insurance,
Right.
when they could be paying $750 or $1,000. Is that free? No, but comprehensive coverage does have to cost something.
The way that the deductibles work with
Yes.
The traditional health insurance, we talked about that earlier.
Yes.
A lot of people know that they're never going to meet that deductible. Everything's going to
Right.
be out of their pocket.
Right.
Alera's got a different system that's really cool. You get
They do.
assistance right off the bat, first thing,
You
right?
do.
So how does that work?
So your deductible is really a hospital deductible, inpatient, outpatient deductible. Because otherwise, you are going to get first dollar benefits. Before the deductible, your preventative care is covered at 100%. The same ACA services that are covered at 100%. Alera has adopted that as well, because that is not only good for the public, but it's good for the company, for people to be, getting their yearly checkups and knowing what's going on with their bodies and catching things before they happen. All the preventative care stuff is still covered at 100%. Yep.
Okay.
Colonoscopy, immunizations for children, mammogram, PAP.
So we said that people on high dollar medications,
Yeah.
this may not be a good fit for them, because Alera has what's called a discount prescription
They
drug
do.
card?
So you basically, with Alera, are going to get about $4,000 a year in outpatient medication costs.
So some people are blowing through more than that in a single month.
Absolutely.
Okay,
But-
So those people, they should probably look elsewhere.
They
Okay.
should, yeah.
Those people should go through the marketplace.
Absolutely. I
Okay.
mean, if you're on thyroid, blood pressure, cholesterol medications, not a problem. But when you start talking about diabetes, MS, cancer, you know, those medications are going to be astronomically high. And, you know, the only place that we have currently a contract that's going to pay for those medications would be an ACA contract, a marketplace plan.
Okay, I see. But people on generic medications, a lot of them,
Right.
they're still a great fit for Alira.
Still a great
right?
fit,
Okay.
yeah, because we have a great RX valet program where, you know, anything you're on a monthly basis, we can set up on a mail order, you know, do a 90-day supply.
Nice.
And in most cases, it's going to be anywhere from, you know, $10 to $30 a month to cover people's medications for a 90-day supply. You know, it's pretty affordable. But just because one family member needs a marketplace plan doesn't mean they all do. And we've been very successful at looking at families and saying, and even small groups where you have a couple of people and one person, maybe, you know, the marketplace plan is best for them, and the other person, you know, because they are really pretty healthy, and they're just buying the insurance for, God forbid, we're able to, you know, split them up and give one person a marketplace plan and the other person
That's really
a
cool.
Alira.
So you can customize it based on the
Customize.
family's
Right.
needs.
Absolutely.
Okay, nice. Okay, so a couple of other concerns that people may have that came to my mind when we were first talking about Alira. Let's talk about what would happen to somebody if they were to enroll in Alira healthy, and then later on down the road they were to discover that they have multiple sclerosis or another autoimmune condition
Right.
that would cost tremendous amounts of money for the drugs.
That is definitely a possibility. A person could pick up a Alira and be very covered and be very happy with them until certain circumstances arise. One, if they're going to exceed the $1 million that's allotted in the contract for healthcare, or if they are going to be on a monthly medication that's going to, you know, cost $1,000 or more a month. We are going to want to transition that person to a marketplace plan. But the marketplace plans have a yearly open enrollment period. It's guarantee issue. So day one, no matter what, you know, they're going to have to cover, you know, that person, that condition, that medication.
So it's really no risk.
No risk, yeah. So if you could start out with Alira, and there could be a circumstance where we would want to, during the open enrollment period, move that person off of Alira and then onto a marketplace plan where they're going to have more benefits for certain brand name medications. Yes.
Okay, because through the marketplace, they have to take all pre-existing conditions.
They have to pay for pretty much any medication that's out there and is approved by the Food and Drug Administration.
Okay, that's great. So that's good.
Alira is outside of the federal mandate of the Affordable Care Act. You know, Alira can say, you know, we're going to offer you $1 million in coverage, and we're going to give you, you know, $4,000 a year in outpatient medication coverage. Whereas the legacy carriers are not allowed to do that. You know, they have to cover every medication that is approved at an unlimited amount.
Okay, wow.
You know, so that adds cost.
It's another reason it's so expensive.
Absolutely. Which is why we manage people's health care. Because, you know, we want to give you the best coverage at the best price at wherever you're at in life.
Right.
Now, that could entail a marketplace plan for that person. But there's no guarantee in that. And then we saved that person a ton of money up until that point that they got that condition and they had to, enroll in a marketplace plan because the overall cost of their medications was just going to be too high for Alira. And there's unlimited benefits on the medications underneath the ACA plans.
Very nice. Last year in 2018, health insurance cost our nation almost 18% of our GDP. Okay, is that remarkable?
It is.
It is, isn't it?
I mean,
I thought so too. It stood out to me.
I believe it, but it is a huge number. Yeah,
It's big.
It is
Yeah.
a big number.
Yeah, and in 2010, when the ACA or Obamacare was enacted, the 6 legacy providers that we were all forced to choose one of.
Yeah.
We were forced to buy
Yes.
coverage by one of them or incur the penalty. Their shares 10x'd, which isn't surprising, okay? But that's just a number to throw out there I thought was interesting. The nation's leading cause of bankruptcy, according to CNBC reports, are medical expenses.
Oh yeah, absolutely.
Okay, that's
in the
number
United
one.
States, that's been like that for decades.
Okay?
Number one cause
Wow.
of medical, number one
I didn't
cause of
realize that.
bankruptcy in the United States, medical. Yes.
Okay, and
I'm
I'm
going
to go on this
country in the
little-
world that also goes on it. Like in England, in Ireland, in Scotland, in Cuba, in Mexico, in Czechoslovakia, in Russia, China, Japan, Australia,
Saudi Arabia.
Austria, Saudi Arabia. America is the only country that will bankrupt you for medical bills if you get sick. Just hammer you. I mean, it literally is one of the things that makes me the sickest.
Okay, so just to drive this home, let me go a little bit further. The report went on to say that 2 million were adversely affected that year. And in the 2009 Obama State of the Union, he said that bankruptcy happened every 30 seconds and to 1 million people per year. That's what President Obama said. Okay, so only 7% of people trust their insurance company. That was a standout, which I'm not surprised to hear that at all.
No, that's
don't
very
trust
low.
my insurance.
I don't, but I mean, 7%. I mean, that's shocking.
Dave Ramsey endorses medical cost sharing, so there's a lot of people that put trust in Dave Ramsey.
Absolutely. I mean,
So that's a good person.
yeah, medical cost sharing has been around for decades.
Yeah, see, it's not a new thing.
It's not a new
We
thing.
kind of we talk about it like it's a new thing.
Right.
It's new to a lot of people.
It is new to a lot
So
of
many
people.
people out there are unaware of it.
It's become very relevant.
It's very established, and I think it's the future. And I think it's, not to cut you off, but
No.
I think it's a more ethical way to handle our health concerns.
For a lot of us, it is, yes. The ACA really addresses insurance for people with chronic conditions. It really doesn't address insurance needs for all of us. And for a lot of us, what Alira offers in their health sharing program is perfect. Most families that are paying $1,800 to $2,000 a month with a $7,900 deductible, we can move them to Alira for $1,100 a month, and they would have all those initial benefits for preventative care, doctor visits, specialist, urgent care, ER, and the medications.
Okay, so let's talk about telemedicine.
Telemedicine.
Okay, because this is a big thing. It's helping a lot of people out. It's been around for a while. It's growing in popularity, although there's still a lot of people not using it. But let's
Right.
talk about what the benefits are of telemedicine. Okay, I recently read that And this was by a reputable source, Ortholine. Okay, in their report, they say 75% of doctor visits, urgent care visits, and emergency room visits can be either prevented or handled safely by phone, which is what telemedicine is. So let's talk about what telemedicine is. Let's talk about, having to leave the house, going to an environment where there may be a lot of other sick people. Sometimes you have kids with you, sometimes it's late at night. This is a 24-hour-a-day service where you can call, and a lot of times, probably in most cases, I think actually, they're able to diagnose and prescribe medications and call them in without you ever having to go to a hospital, urgent care, or a doctor's office.
Correct. Absolutely. I mean, anytime you utilize an emergency room, that's going to be the highest level of cost that you can do.
Sure.
It's just like buying a candy bar at a convenience store. Why is it at 50 cents more? Convenience. Urgent cares are going to be
Probably next.
next in line, yes. And then your typical doctor visit. So all those take time. They put you around other people who are sick. And it also takes you away from your job and takes kids away from school. One thing that the legacy carriers and Alera offer are programs where you can access doctors and medications 24 hours a day without even leaving your home. So if you go to the doctor, if you have a telemedicine phone call, they can prescribe you medication. The RX valet can have that sent to your home.
Oh, wow. That's awesome.
It is a very nice benefit. So we don't have as many people utilizing that as you would think, just because people are so conditioned to, my kid doesn't feel well, let's take him to the ER because it takes too long to get into the doctor. And they want to get a medication slip so they can run down to the pharmacy, stand in line, get it filled, and then come home at the end of the day. Typical day of being sick is spent at a doctor's office or in an ER waiting room, and then waiting around for a medication.
Yeah, you're right about that. Well, listen, I think it's clear that for a lot of people, this is going to be a tremendous value and kind of a no-brainer. So we've talked about who we can help. We've talked about who this is not a good fit for. Let's just address a couple more concerns that some people may have. I know a lot of people might have a family doctor they've been seeing for a lot of years. Now, if they made a switch from, a traditional health insurance to medical cost sharing like Alera, are they at risk of losing that family doctor, the one they've gone to for years? Are they going to be in network? Is that kind of how it works with Alera? Or
so every insurance plan is going to have a network, which you want your plan to have a network. The other option would be that it's a non-network plan, which means that you could get stuck with additional pricing from bills that you weren't expecting. When you're in network, that means that when you go see that doctor or hospital, there is an agreed upon price. And past your copay or deductible and out of pocket, it's a zero balance billing plan. Okay? So Alera is going to use PHCS multi-plan, which is a nationwide provider. So you're going to have access to millions of doctors and hospitals all throughout the United States.
So it's
So
a
you-
big
So it's a
network.
huge network. Yeah, absolutely. One of the bad things about these ACA plans, especially in Missouri and Illinois, is that they have gone to a state-specific network, which means that you literally have no out of network and you have no out of state benefits. So if you or your child gets sick and you wanted to go to the Mayo Clinic in Rochester, with Anthem, the way these plans in Missouri are set up, you would have no benefits to go up there and seek treatment. Whereas with Alira, with their nationwide network, Mayo is in the network. So you could travel from Jefferson City up to Rochester, Minnesota to get the treatment paid underneath your policy that you want.
Wow, outstanding.
Yeah, absolutely.
I'm impressed. Alira medical cost sharing, massive value.
Absolutely.
I mean, if you're healthy lifestyle, you get rewarded. Save money, okay? I know a lot of people are thinking this is probably a perfect thing for me. I could use thousands of extra dollars a year. What's their next step? What do they need to do this?
Go to healthinsuranceThinkTank.com.
Okay.
Call in. We'll do a little evaluation. If we determine that Alira is going to be the best fit for you, we can complete enrollment in about 10 minutes. And our effective dates are the 1st and the 15th of every month.
So basically, you'll just take care of everything.
Yes, we will.
Okay.
Just give us a call or visit healthinsuranceThinkTank.com and we will get you taken care of.
That sounds awesome. Well, you've always taken care of me and my family. I know that, so
Thank you.
I know that you have the knowledge, and I appreciate you a lot. I'll tell you what, guys, if this has been helpful for you, if you've enjoyed this at all, we'd love to hear more about it in the comments. Please say something. If you have anything to add, we'd love to hear from you. Come check us out at healthinsuranceThinkTank.com for more information and look for some more of our videos to come in the near future. Thanks. We'll talk to you soon.